Hello and welcome to this video on the exciting research being done on detecting Alzheimer's disease in the retina of the eye. Alzheimer's disease is a debilitating condition that affects millions of people worldwide, and early detection is critical for the effective treatment and management of the disease. In recent years, researchers have been exploring the possibility of using the eye as a window to the brain, as changes in the retina have been linked to neurological disorders such as Alzheimer's. By analyzing the structure and function of the retina, scientists hope to develop a non-invasive and affordable method for early detection of Alzheimer's disease. In this video, we'll dive into the latest findings on this fascinating topic, exploring the potential of retinal imaging as a diagnostic tool for Alzheimer's disease. We also discuss the challenges and the limitations of this approach, as well as the future implications of this research for patients, clinicians, and the wider scientific community. So sit back and relax. Let's explore the cutting-edge research on detecting Alzheimer's in the retina of the eye. And like always, if you get something positive out of this video, we do ask you to give us a subscribe. It really helps the channel and helps our community grow. In fact, how about you right there? Yeah, you. How about you just sign up? Doesn't cost you anything, and you'll be our one subscriber for the day. Thanks, and let's get started. The eye is the gateway into the brain, ophthalmologist Dr. Christine Gears said. She's also the head of medical education at the Boca Raton, Florida Center for Neurodegenerative Disorders. By gazing into the back of the eye towards the optic nerve and retina, you may see right into the neurological system. Studies have looked into how the eye may be used to detect Alzheimer's disease before any symptoms appear. When memory and conduct start to suffer, the illness has already progressed considerably. Decades before memory loss symptoms appear, Alzheimer's disease develops in the brain. Dr. Richard Isaacson, a neurologist who specializes in Alzheimer's prevention and who practices at the Center for Neurodegenerative Disorders, stated, "If medical professionals can spot the illness in its early stages, people will be able to lead healthy lifestyles and manage their modifiable risk factors, such as diabetes, high cholesterol, and high blood pressure," Dr. Isaacson said. How soon may we start seeing cognitive decline? To find out, a new research evaluated donated retinal and brain tissue from 86 individuals who had varying degrees of mental deterioration. Our work is the first to offer in-depth assessments of the protein profiles and molecular, cellular, and structural impacts of Alzheimer's disease in the human retina, and how they connect with changes in the brain and cognitive performance, said senior author Maya Koroyo Hamoi, and I'm sorry about the pronunciation. According to the doctor, these alterations in the retina were associated with changes in the entorhinal and temporal cortices, a center for memory, navigation, and time perception. Over the course of 14 years, 86 human volunteers with Alzheimer's disease and mild cognitive impairment provided retinal and brain tissue samples for the study. According to the scientists, this is the biggest collection of retinal samples ever investigated. The samples of donors with normal cognitive function, those with mild cognitive impairment, and those with advanced Alzheimer's disease were then compared. The research, which was released in the journal Acta Neuropathologica in February, discovered substantial increases in beta amyloid. In persons with both Alzheimer's and early cognitive impairment, a critical indication of Alzheimer's disease. According to the study, microglial cells in those with cognitive problems decreased by 80%. These cells are in charge of maintaining and repairing other cells, as well as removing beta amyloid from the retina and brain. Isaacson, who was not involved in the study, stated that markers of inflammation were also observed, which may be an equally relevant marker for disease development. The findings were also noticeable in individuals who had no or fewer cognitive symptoms, indicating that these novel eye tests may be ideally positioned to support early diagnosis. Both immune cells that are closely packed around amyloid beta plaques and other cells that cause inflammation and cell and tissue death were discovered by the study's researchers. The study discovered that tissue atrophy and inflammation in cells in the distant periphery of the retina were the most accurate indicators of cognizant state. According to Isaacson, these results may ultimately lead to the development of imaging tools that allow us to identify Alzheimer's disease earlier and more precisely, and see its development without intervention by staring through the eye. And that's a wrap on our video discussing the promising research being done on detecting Alzheimer's disease in the retina of the eye. We hope you found this video informative and thought-provoking. If you have any questions or comments about this topic, please feel free to leave them in the comments section below. And don't forget to hit that like button and subscribe to our channel for more fascinating insights into the world of science and technology and medicine. Thanks for watching.